If you have questions, please feel free to put them into the chat. I'll try to keep an eye on that, and if I can answer your question at the time, I'll do so. Otherwise, I can address additional questions at the end of the session, and if you don't feel like typing, at that point we can turn the microphones on and you can just ask your question that way. That will be a little bit easier. So let's get right into things today. So the outline for today's session, we're going to look at some of the musculoskeletal changes that occur with scleroderma, and then more specifically, some of the changes that occur to the hands. We'll talk about strategies for protecting your hands during daily activities, go through some basic hand exercises, and then I'll give you some information, general information about exercise, as well as resources that you might find helpful if you are looking for more ways to stay active or more education sessions to attend. So as you know, there are many musculoskeletal changes that occur with scleroderma. So with the skin tightening at the hands, you have joint contractures, particularly of the fingers. And of course, that can happen at other joints as well. There can be arthralgia, which is joint pain, and arthritis, so inflammation of the joints, synovitis, so that's inflammation of the lining of the joint. There can be tendon changes, so tendinitis, inflammation or aggravation of the tendon. Tendon friction rubs, so some of the thickening around the tendons. There can be that sensation of rubbing or even a sound that occurs, and muscle pain, weakness, and fatigue are also common. So if we look more specifically at what's happening in the joints, on the left side here we have a normal joint. A joint is anywhere two bones meet. The ends of the bone are capped with cartilage, and the cartilage allows the bone to move smoothly over the bones to move smoothly over each other because cartilage doesn't have any nerve endings in it. So you have no sensation through the ends of the bone when you have that nice cartilage that's lining the ends of the bone. Cartilage also does not have circulation to it, so it gets its nutrients from the fluid in the joint, which is called synovial fluid. And the synovial fluid is secreted by the synovial membrane. And then we have a joint capsule, there's ligaments around the area, and then muscles that attach in via tendon as well. So when you have arthritis, inflammatory arthritis specifically, the body is attacking its own healthy tissue, and you have that swelling or inflammation of the synovium. You'll have degeneration of the cartilage on the ends of the bone, and when we lose that cartilage, the bone now has more load through it, and bone has lots of nerve endings, so sensation through the ends of the bone. You can have bony erosions, and then soft tissue structures around the area can become inflamed, and the muscles also weaken around the area. And when we talk about soft tissue structures, these are some of the areas as well that are thickening, laying down extra tissue when there's scleroderma. So it's a combination of factors causing that pain, that stiffness, that limited motion at the joint. So I just briefly wanted to go through the anatomy of the hand just so that you know which joints I'm referencing. So if we start at the bottom of the screen here, you can see the wrist bones, which are called the carpals, and then the bones along the back of your hand are metacarpals. So joints between the carpals and the metacarpal are called carpal metacarpal joints. This one here is pointing to the base of the thumb because this is a commonly affected joint with arthritis. It can cause a lot of issues, a lot of pain at the thumb. Then the joints following that are the metacarpal phalangeal joints because your fingers are your phalanges. So again, the joints are labeled according to the bone name. So MCP joints, those are the big ones of your knuckles. And then the joints of your fingers are your IP joints, your interphalangeal joints. So the ones that are closer to the hand are the PIPs, proximal interphalangeal joints, and then the furthest ones are the distal interphalangeal joints, DIPs, PIPs, DIPs. So what happens to the hands, or what we see with scleroderma? So decreased thumb mobility, and the web space decreases, tightens, and this is something that we commonly see with arthritis. The thumb drops into the palm of the hand. It's hard to extend the hand. You can't get this nice big space here. MCP joint stiffness is very common, so a hard time getting those MCPs to bend, to move into flexion. And PIP extension can be very difficult as well, so getting those fingers to fully straighten is difficult. There can be joint swelling, warmth, and tenderness, or there might be periods of time where there's swelling, warmth, and tenderness when things are aggravated. Of course, Raynaud's, I'm sure most of you have Raynaud's phenomenon. Puffy fingers, digital ulcers, and the decreased ability, actually the calcium deposits is missing from there as well. Decreased ability to pick up small things, or you're dropping things, that loss of manual dexterity because of all of these issues that are occurring. So ideally, we want to maintain or improve mobility and function, reduce pain, and slow down the progression of joint damage. How do we do this? So a lot of the things that we recommend for hands are things that you want to try to be doing on a daily basis. They're things you do yourself. So we refer to these as self-management strategies. Part of this is protecting your joints during daily activities, using heat to try to soften up tissues to make it easier to do stretching, help bring down pain. Specific exercises for mobility is important. And a second step listed there, splinting advanced exercise. So this I really put as a second step because anything like this, of course, you want to have a hand therapist involved, or a physio or occupational therapist with knowledge of your condition, so that you're getting the most appropriate exercises. You're getting the splints that you need depending on what's going on in your hands, because it can be so different from person to person. So the type of positions that are hard on the hands are things where you're using a tight grip, where you're squeezing and pinching. Okay, so lots of load going through those joints. For many of you, it's probably difficult to get into those positions as well. Particularly difficult or a lot of loading occurring when you're holding those positions, or you're doing them over and over again. For the thumb, it's the pinch with the thumb against the hand and the index finger. So we call this a lateral pinch. And the reason this is hard on the hand is that what we're doing when we're constantly going into this pinch position is we're actually tightening up this web space, and we're putting the thumb into that position of deformity that we see with arthritis. So we want to avoid this lateral pinch position as much as possible. So think of the number of things that you might squeeze throughout the day. This is showing squeezing a bottle, whether it's ketchup or mustard, dish soap, so many different things that we squeeze, lotions, toothpaste throughout the day, often getting into that lateral pinch position. So these are the sorts of activities that we want to start to think about. And then positions where the fingers are pushed toward the baby finger are hard on these MCP joints. So we see with an inflammation of the MCPs, when we're always putting this stress towards the baby finger, over time what can happen is people's fingers actually start to deviate towards that side. So this is just showing that example of opening a jar where you're really loading, pushing the fingers to the side. And again, you're kind of moving towards that position of deformity. So it's a position that we want to avoid. So what do you do instead? So ideally, if you can, apply pressure through the base of the hand. That's a good place to put pressure, or through the side of the hand here. So this is a nice long bone. There aren't any joints here. As long as you don't have any sensitivity through the side of the hand there from calcium deposits or that sort of thing, you should be able to effectively put pressure through that outside part of the hand, kind of like a karate chop motion. At the thumb, ideally, you want to be thinking about using an O grip rather than this collapsed pinch grip. So an O grip means that when you touch your thumb to your index finger, you should see these bumps sticking out. So you see this MCP of your thumb and the IP joint stick out compared to collapsing in. Okay, so that's what we call an O grip. The other thing you want to think about is using your bigger joints as much as possible. So we're not using those small joints of the hand and putting that load through them. So some examples to think of. So pushing up from a chair. I'm not sure many of us would push up with our fingertips anyways, but pushing through the base of the hand and opening a door, or maybe you'd push with your fingers. Can you use the side of your hand, the base of your hand, your shoulder or elbow to push through that door rather than loading the joints of the hand? Carrying items close to your body using your bigger muscles as much as possible. So think of those big jugs you take out of the fridge with milk, 4-liter jug, and you're holding it, lots of weight going through all those small joints. So instead, could you pick it up from underneath, carry it close to your body? Can you consider some of these things when you're shopping? Maybe you're not buying the 4-liter jug of milk. You're getting smaller jugs of milk that are easier to pick up and carry. Do you carry a lot of grocery bags with your hands? So again, tight grip position, lots of load. Can you instead have bags that you can put over your forearm, or you can have it over your shoulder? Or even better, can you have a wheeled cart? So I have that tendency even when I go to the store and I need to pick up a few items, I grab one of those baskets thinking I'm picking up 1 or 2 things. And then often by the time I get to the till, it's heaving. I've filled it up. I'm carrying it along. It's so heavy through the hands. Also your shoulder, your neck, all your other joints. Take the cart. Use the cart whenever you can. Think about buying pumps, so shampoo, conditioner. Make sure it's in a pump. You're not having to pick it up and squeeze it. And can you pump through the side of your hand? Could you put your dish soap into a refillable pump? All of these things you're thinking about so that you can minimize the load. So these are examples of ways you might be able to use an O grip when you're doing different activities. So for example, if you were picking up, I would say a couple pieces of paper, you might try to hold them in more of this O grip position with your thumb sticking out as much as possible if you're able to do that. If it's anything more than a couple pieces of paper, I would say just pick it up from underneath. In the middle, showing an aid for opening a jar, and it puts your thumb into that O grip position. Compared to the one on the right, you can see the web space is diminished and that person's thumb is actually hyperextending. It's starting to move backwards. And this is sometimes what we see when people lose some of that web space, but they're still trying to spread their hand, is you actually get this backwards motion of the thumb, which can lead to a lot of pain. And then at the bottom, doing a zipper, using a key. Is there any ability to try to be in more of this O grip position if you're able to achieve that position? Now, for the most part, we're not all able to walk around all day thinking about how we're going to use our fingers like this, right? We're just using our hands. We're not thinking about it all the time. So oftentimes what works better is to consider the things that you use throughout the day and try to ensure that they have a larger grip. So any sort of pens that you have, can you get a larger pen, or can you build it up by using some sort of foam tubing? The image on the bottom is showing Coban used as a wrap in order to build up the diameter of the pencil. I would suggest maybe do it with a pen instead, because you'd have to remove that if you were sharpening the pencil. At the top there, you can see that that's copper pipe insulation. So something you can buy at a hardware store. It's meant for insulating copper pipe. Really inexpensive. It sticks to itself, but you could use it to build things up, like your blow dryer, your hairbrush, if you like to garden, gardening tools, bike handles, walking poles, whatever it might be, so that it'll naturally keep you in this more open grip and you're not having to put as much load through those finger joints. And I'm sure many of you have discovered these tools on your own, particularly if you do have limited mobility. Good Grips by OXO, whole line of tools with these nice big handles. And again, much better hand position when you're using these. Use levers as much as possible. So this is an example at the bottom. This is a Good Grips jar opener, bottle opener. It goes from a very wide diameter to a very small diameter cap. And you slide it on, and then you're pushing or pulling using a more of a full body motion rather than that small twisting motion of your fingers. And again, if you're struggling with your dexterity and that sort of thing, this can be very helpful. If you use a computer, what's your posture like at the computer? Are you in a neutral wrist posture as much as possible? Do you use a phone? So lots of people nowadays are texting and that sort of thing with their phone. They're gripping it for long periods of time, and then they're pushing through their thumbs in many cases. Your thumb is dropping into that position of deformity. So how could you change this? Can you use the voice technology on your phone? So you're pushing the little audio voice button and you're dictating your text, you're dictating your emails. So you're not having to use your hands quite as much for those repetitive sorts of activities or that sustained posture where you're actually holding on to the phone like that. Top right there is showing some examples of gardening tools that keep you in a more neutral wrist and hand position. Nice big diameter handle. Lee Valley is really great for finding these tools, so you can order online from them. There's a store in Vancouver as well as Victoria, but they really have a lot of different sorts of tools, not only for gardening, but also for use in the kitchen, that sort of thing. So door handles can be really challenging, or door knobs can be really challenging. Can you build them up? You can get these adapters that you slide over the door knobs, or even better, if you can change it to a lever style, that will make it much easier to use. All new buildings actually have levers because they're accessibility items rather than doorknobs, which are much harder for people to grip. In the middle there, this is just showing a mandolin. So this is a strategy for being able to keep your hand in a neutral position while chopping or slicing. If you are able, use electricity. There's a chopper on the right there, Cuisinart. So, maybe it doesn't chop it exactly how you would like it chopped, but is it good enough? Bottom left, that's an example of a vegetable peeler. So you slide it onto your finger and then you're just peeling like this. You're not having to grip. So there's so many different tools out there nowadays that are really helpful. So if anyone has found anything that they love, feel free to share it with the group. We can all learn from what you've found yourselves. Book holder, great way to keep a book upright, not have to hold it open in that sustained posture. So again, think of books, newspapers, things you're holding for long periods of time. Could you put the newspaper on the table in front of you? Put the book in the book holder. Ebooks are great because you can just have them sitting in front of you and you're just doing a little tap to move to the next page. That's a pop socket shown with the flowers on it at the bottom. So this is something you put onto the back of your phone, and then you can just slide the phone between your fingers. So again, it's taking away that sustained grip. And then bottom right showing the refillable pumps. But again, I would be pumping through the side of my hand if at all possible. So many different things out there that can be helpful. So a lot of people find it very hard to scrub, cleaning, that sort of thing, that holding on to the scrub and use an electric scrubber if you can. So that's one shown there. Foam grip tubing. This one in the middle, it has different diameter holes in the middle. So you can put in different items from utensils to pencils to hairbrush. I have one at my office that fits a paintbrush in it nicely, makes it much easier to hold. Jar keys for breaking the seals on jars. And then you could use some of the shelf liner shown right below. You can get that at the dollar store, cut it into squares. Have a square that you put under the jar, a square on top, and then use more of a full hand motion in order to open the jar. And foam grip tubing again shown, or the silicone pen grips shown in the bottom. These are easy things to find online. Another really important thing to consider is how you pace and plan your day. So oftentimes people use pain as a signal to stop. And ideally, what you want to try to get into the habit of doing is stop before you experience pain. Once you have pain, generally you need to take a break. You might not be able to resume your activity for a prolonged period of time. And you might need to take something to manage your pain, some sort of pain medication. Whereas if you can stop before you have the pain, often you can take a 10 or 15-minute break and you might even be able to continue with the activity and do a little bit more. Now, this is a very hard thing when you're used to doing everything that you want all at once, and now you're having to stop and take breaks. You're having to think about what you did earlier in the day or earlier in the week. But it can make a really big difference for your overall activity levels and your overall ability to get things done. So I've had a lot of clients say this is one of the hardest things they've had to do for managing arthritis, managing pain. But when they start to be able to pace and plan, it really makes a big difference for overall activity. So spread things out, ask for help for those harder activities as well. And this is not only a strategy for the hands, but it's a strategy around fatigue management, trying to just spread things out as much as possible. So what about splints? They can be a good way to reduce pain, stiffness, and swelling. They might help to improve function when your hands are supported in a neutral position. They can reduce or prevent deformity. So in that way, again, it depends exactly on what you have going on in your hands, but they might just be able to protect the joints and prevent them from getting stressed, which can stretch out some of those ligaments around the area and lead to deformity. The one on the bottom, for example, is one that supports around the thumb. It's not going to prevent the thumb from dropping into the palm of the hand, but it is sort of a good reminder to keep that web space nice and open when you're wearing something like this. But definitely you would want to see a hand therapist or an arthritis occupational therapist or physiotherapist in order to ensure that you're getting the right splint for your own condition. And the Mary Pack Arthritis program is available throughout the province. I know that it's not available in every center, but there are different sites that do have specialists in inflammatory arthritis, and they see scleroderma at all of the programs across the province. It does require a rheumatologist referral. So if you haven't been already, there is a clinic in Penticton, there's one in Cranbrook, there's Victoria, as well as Vancouver. And I recognize this doesn't cover the whole province, but maybe you're coming down to Vancouver for a visit, and it could be something to organize if you haven't been able to do that already. A splint should be comfortable. It shouldn't cause any numbness or skin or redness. And really the wearing guidelines will depend on the purpose. So sometimes it might be made as a nighttime splint. So So maybe your finger doesn't straighten all the way, for example, and it's made to be worn at night to prevent that from becoming worse. It could be worn during the day to protect joints during activity. Or it might be worn during a flare-up when things are aggravated to rest the joints, settle them down. So this is where a hand therapist or an arthritis OT or PT could really give some very specific advice. So heat and massage can be helpful for relaxing the tissues. And for the hands, you might consider things like paraffin baths, electric moist heating pads, microwavable hot packs, warm showers, or baths. It should be warm, not hot, and you're using it for about 15 to 20 minutes, not for more than 30 minutes, certainly. And be a bit cautious if your joints are really red, hot, swollen, aggravated. Oftentimes, putting heat on can feel nice in the moment, but you are bringing more circulation to the area. And sometimes people end up feeling a lot more stiff and sore after the fact. It can be helpful before exercise, trying to loosen up some of that tissue. The massage, even using some lotion to loosen up the skin a little bit might help. Or if you don't tolerate that, even wearing warm mittens or gloves for 15 minutes prior to exercise might be helpful. So hand exercises are meant for maintaining function and range of motion. Ideally, they help to prevent or slow the development of deformities and contractures. And it's really important to start hand exercises before there's any loss of motion. We want to keep everything as flexible and mobile as possible. Once you've lost motion, it's much harder to regain it. And a few guidelines here. When you're stretching, you want to stretch for about 5 to 10 seconds, even if the skin blanches or turns white. You can repeat each stretch 5 to 10 times for a set. If you do have any sort of painful hand ulcers, you might need to reduce the number of repetitions so that you're not aggravating them as much, but you still want to maintain those mobility exercises when you have hand ulcers because you want them to stay flexible as they heal. You can alternate your fingers or your hands to allow blood flow to return. And ideally, you're trying to do hand exercises about 2 to 3 times a day. So I'm just going to go through some of these exercises. And the first one is flexing or bending the knuckle joints, the MCPs. So this is just showing trying to bend the fingers as much as possible and then using your other hand to press them down. So I recognize that this might not be realistic for everyone who's here today, but this is just a good mobility exercise for working on those MCPs. And you wouldn't, if it's painful, like really painful, you're not pushing through that pain. You might push through a little bit of resistance, but say if it's sharp pains, you do want to back off. We don't want to cause additional swelling, aggravation, and then end up with more fluid around the area and more stiffness of the joints. You can practice the bending of your IP joints. So ideally with this one, you're thinking about trying to bend your fingertips to the base of the finger if you can, and then you can use your other hand in order to increase that motion. And if you have a couple fingers that are more stiff, you might have to do this one individually. So it's bending that finger down to the base of the finger, getting bending of the PIP as well as the DIP, but really that PIP for sure can lose a lot of its range of motion. And then on the other hand, we want to try to get the fingers as straight as possible. So the first two exercises there are showing using a surface in order to support the hand. And then you are using your other hand to push down and try to straighten the fingers. The middle one is showing doing it one finger at a time. So again, this would be on a surface of some sort. You have one finger that's below the PIP, another one that's underneath, and you're trying to just straighten at both of those joints. And then the third one that you see there is not using a surface for support. Rather, it's using the thumb at the backside, and then your index and middle finger are supporting around the top of the finger, and you're just really using your own the pressure on either side to try to get straightening through those finger joints. This is hand extension or straightening, so trying to get all the fingers straightened at once. Again, this might not be something that you can do, but if you can, it's a good way to straighten all those fingers at the same time. So you're trying to press the fingers against each other, really press the palm of the hands together in this prayer type position. If that doesn't work for you, then you might have to move into doing each finger individually instead. Stretching the web space. So as I mentioned, this web space gets very tight. So the space between the thumb and the index finger, so the skin tightens, but also this muscle tightens and can pull the thumb in towards the palm of the hand. We see that a lot with arthritic changes at the joint. So you can try to do a little bit of massage in the area using a small ball. Put the ball on a surface, and really you're just rubbing your hand over the ball until you feel kind of like a pressure point, and then you'd hold it on that area 45 to 60 seconds. Hopefully you feel a little bit of a release in the area, and then you can move into a bit more of a stretch. So stretch shown at the bottom left with your thumbs and your fingertips together, and just really trying to increase this web space as much as you can. So again, 5 to 10 seconds, or this is sort of a larger area here. If it's comfortable enough, you might be able to hold it a little bit longer. And then the bottom right is showing using a bottle or a cup, trying to get it into the web space to just increase that space and stretch around the bottle. Thumb flexion. So the thumb can become hard to bend. So practicing bending, touching over towards the base of the pinky finger is a good exercise to do. And again, you would just take it there and you're doing a little bit of a hold. You can use your other hand to help out if you need a little bit of extra support. The web space between the fingers can also become tight. So practicing things like interweaving your fingers, interlocking your fingers, trying to get them as tight as possible to get a little bit of a stretch of the web space there can be a really helpful thing to do. In the middle, that's showing using like a water bottle or something that has a smaller type cap lid, trying to get that between the fingers. Now just be careful if your skin is a little bit delicate, that might not be the best option for you. And top right is just showing that one strategy for kind of keeping track of the mobility is tracing your hand. You can trace your hand prior to exercise, trace it again after exercise, see where there might be improvements, as well as you can carry that forward, use it from week to week, and see how much you're able to maintain your hand mobility over time. And then for the wrist, moving into both flexion, so bending forward is important, as well as extension, bending backwards, in order to stretch out all the structures around the hand. Okay, so I just wanted to talk briefly as well about full body exercise. Really important to try to stay as active as possible. So any sort of movement is really helpful, but the ideal is having some mobility exercises, doing some stretching, some strengthening, as well as low impact aerobic exercise. We know when you're getting your heart rate up and you're breathing harder, it has an anti-inflammatory effect. It's also really great for expanding your lungs, for expanding your rib cage. So doing things that get your heart rate up, get you breathing harder are really important. However, we want to ensure that you're trying to include as many low impact activities as possible. So low impact meaning there isn't a lot of jumping, bouncing, quick stop starts, turns, pivoting, that sort of thing, where you could potentially damage some of those soft tissue structures around the area that are already vulnerable to damage. So if you are able to exercise in water or it agrees with your skin, again, it might not be the case for everyone. This can be a good thing to consider because when you're in water up to your waist, you're taking a lot of weight off of your lower body, about 50%. And when you're in up to your shoulders, you're taking about 80% of the weight off of your body. So many people can get into the water and do much more than they could do on land. So maybe it's walking in water, swimming, or getting into deep water with a flotation belt or a noodle, doing cycling, jogging in the deep water. All of those are really great forms of exercise. Walking is considered low impact. Some people who have really sore lower body joints find that an aid like walking poles can be helpful. But you'd have to be cautious if your hands bother you a lot because you are transferring some of that load onto your upper body. So again, a big diameter handle would be really important, and you would want to start with very small amounts to see if it would work for you. Activities like Pilates and yoga are really great for mobility, for building up some core strength, which can be helpful for many people. And of course, the best thing that you could do is see a physio one-on-one who can really help you to identify your strengths and weaknesses and give you a very specific exercise program. So just wanted to show you some adapted tools for exercise in case your hands are impacting your ability to do activities that you might like to do. You can find a lot of these types of tools online, like the yoga grips. So you can see there that you're able to keep the wrist and fingers in a much more neutral position. You're not putting the stress through the finger joints. The yoga wedge can be nice for that reason as well. Bear blocks on the bottom left, those are made by a Canadian company. And again, if you look for those online, they are really helpful for people who are trying to do like push-ups or any sort of activity where you're putting a lot of that load through the hands. Oftentimes people find wearing some kind of a glove that has a bit of foam cushioning in it, as well as a bit of grippiness, will make it easier to do things in the gym. If you're using pulleys or that sort of thing, they're easier to hold and it'll keep your hand more open. But TheraBand is another great option because you can tie a loop in the TheraBand and then you're not having to actually grip onto it. And some people who are into weightlifting like these weightlifting hooks because you're putting those around your wrist. The hook sits comfortably in the palm of the hand, and then you're not having to grip onto the weight as much. So it really depends on what you like to do for your own sort of exercise. Just a note here about inactivity. So even if you are getting regular exercise, if you spend the rest of the day being sedentary, you are at a higher risk for all sorts of chronic health conditions, as well as your risk of mortality actually increases just due to that time spent being sedentary. So even say if you get a half-hour walk in the morning, but then you end up maybe you're driving to work, you're sitting all day, you're driving home, you're sitting in the evening. All of that sitting time has found to be a really poor, a lot of people's overall health is very poor when they have that excess sitting time. So Canada's 24-hour movement guidelines say that your whole day should matter. A healthy 24 hours should include physical activity of some sort, sleep, 7 to 9 hours of good quality sleep, and limiting sedentary behaviors to 8 hours or less during the day, but making sure that you are breaking up long periods of sitting as often as possible. So we're supposed to stand up and move around every half hour throughout the day. Having said that, we've been here for about 40 minutes. So if you want to stand up and move around, please feel free to do so. Even just standing on the spot and taking 40 steps is enough. It breaks up that sedentary time. It gets those large muscles of your lower body working, which can reduce the risk associated with excess time being seated. So small tips for exercise. If you're trying something new, or you're trying to increase what you're doing, you want to do it very slowly and gradually. I often hear from people that they don't know that something aggravates them until after the fact. It's that night, it's the following day when suddenly you're like, oh, I shouldn't have spent 3 hours in the garden doing my gardening cleanup, even though I felt great at the time, right? You pay for it afterwards. So again, it's that pacing, planning, keeping track of what you're doing. Maybe you decide to go on a longer hike. Make sure it's just a little bit longer. See how you feel after the fact. If you feel great, fabulous, you can increase from there. Instead, the alternative is you aggravate your joints and then you spend a couple days recovering from it, where you're not able to do much at all. Break up activity as much as you can. So remember, a 30-minute walk is equivalent to two 15-minute walks or three 10-minute walks. They're all an equal amount of exercise. But people with a lot of pain, fatigue, often find that smaller amounts of exercise more often is a lot easier on the body. Maybe you take a break. You only have time to go for a walk at one point of the day. Can you walk somewhere where you can sit down? You can do some gentle stretches or movement exercises, and you can carry on from there. Maybe you break up your time at the gym between seated and standing activities. So however you can break things up. Warm up, so maybe starting with some movement exercises, starting more slowly before you move into your brisk walk. That's all helpful for sore joints. Think about timing your exercise for when you feel your best, maybe less stiffness, less fatigue. What's the ideal time of the day for you? Time your medication around exercise. We know that people who pre-medicate tend to take less pain medication over time. So if you know that you go to your exercise class and then afterwards you need to take your pain medication, it would be actually more effective to take it ahead of time. So about an hour before the class. And again, this is something that's counter to what many of us like to do. Lots of people will say, I only take pain medication if it's really bad, but you might be doing yourself a disservice. Then maybe you're not going for your walk. You're not doing as much as you could if your pain is controlled. And sometimes keeping an activity diary can be helpful. You can find out or start to see the links between activities you're doing, pain levels, and kind of come up with a plan to see what works for you, what doesn't, how you can modify things and come up with the best exercise plan for you. So sometimes people will experience pain during activity, and that can be normal as long as the pain is not extreme. So you're not getting a high amount of pain. Maybe you have a small increase in pain while you're going for your walk. That might be okay. Ideally, what we want to see is that your pain level comes back down when you finish the activity. And certainly it's not lasting into the next day. So if you find you consistently doing exercise and then the next day your joints are really aggravated, that's a sign that a change is needed. What can you do differently? So think about all these things we've been talking about. Do you need to take more breaks? Did you just do too much at once? Do you have to back off a little bit? Did you progress too quickly? Do you need to pre-medicate? So ways to ensure that you're not consistently getting that long-lasting pain. Again, working with a physio can be very helpful. They can give you specific exercises. It might include range of motion exercises, stretching, strength, balance exercises are important too. Some of you might have joints in your feet, your lower body that really bothers you, and certainly balance is greatly impacted with those changes. They can provide modifications and progressions as able. Oftentimes I'll say to people that if price is a concern working with a physio, then really make it clear that you're there for an exercise program and you just go back periodically for progressions. so that you're not going twice a week, for example. Maybe you're going once and you're returning a couple weeks later to see how it's going for you, to change things around, or maybe to progress if you're able, rather than having to go so often where it gets expensive. But they can really help to give you ideas of exercises and pay attention to alignment and control, which is so important when you're exercising. And then it's those principles that you can take over to maybe another class that you're doing, or you're using it when you're thinking about bending down to the floor to pick something up. How are your joints aligned? So for example, on the left there, you can see this person is doing a lunge type motion, and the hip and the knee are aligned right over the foot, which is much easier on the joint compared to the joints of the hips and the knees, compared to the one right beside it, where the knee is really angled towards the inside. The hip is internally rotated, but it's hard to identify these things ourselves unless we're exercising in front of a mirror or that sort of thing. But over time, if you're getting that feedback about alignment control, then you can start to integrate these things. And also thinking about if you live in an area where there might be a community center that offers classes that might have specific programs where they really focus on this. And they might be described as like gentle, low impact, modified, adapted. All of these are some of the key words you want to look for when you're looking for exercise programs. Arthritis Society Canada has some really great videos on their website. So I just wanted to show this to you here because sometimes people are looking for things they can do at home. So they have on their website a section that has a physical activity guide. And when you scroll down, you don't see it initially, but it says playlists. And within the playlist, they have some of these videos for warming up the joints. They've got chair yoga, Tai Chi, all sorts of different activities. I don't have it on the screen here, but if you scroll down on their website, then you can even see specific videos for knee exercises, hip exercises, etc. They are labeled as osteoarthritis exercises, but they're I would say fine for inflammatory arthritis as well. So that might be something helpful for you to check out. The other thing I did mention earlier was the Mary Pack Arthritis program. I'm sure you're all familiar with this, but just wanted to show you their website. It's www.vch.ca/marypack. It does have all of the clinics throughout the province. And then when you scroll down, it has the education that's provided. And a lot of the education is provided by Oasis. The classes are for people who have osteoarthritis as well as inflammatory arthritis. And we do in-person classes in Vancouver, Richmond, and the North Shore. And then we also offer online arthritis classes that you can attend throughout the province. So this is just looking at some of the online classes. We have classes on managing hip and knee arthritis. This is with our occupational therapist. I do a class more specifically on exercise and arthritis with more of a hip and knee focus. We have a dietitian with our program. She does lots of different classes, nutrition and arthritis, supplements. She does classes on mindful eating. So if you're looking for this information, take advantage. Our nurse with our program does classes on pain management. She does a class on meditation, using cannabis for pain management, sleep and stress. So all sorts of different classes. You can take a look at the website and you'll be able to see those. So key points that we discussed today: protect your hands during daily activities. We looked at all those joint protection strategies, including tools you can use, as well as pacing and planning your activities. Try to incorporate regular mobility exercises into your routine. Of course, I just showed you some basic hand exercises, but that would be important to consider for other affected joints as well. So a hand therapist, a PT, and OT that specializes in arthritis would be a great resource for giving you not only hand exercises, but a physio could give you full body exercises as well. Keep your whole body moving as much as you can. Try to reduce sitting time and be realistic, progress slowly, respect your limitations. I'm sure for many of you, you have good days, you have bad days. Be kind to yourself. That's part of managing a chronic condition effectively. Remember, some days it's enough to maybe just get up and get moving, or maybe just focus on, okay, today I'm going to make sure I'm not doing too much sitting because I don't really feel like I can do my walk. And if that's where you're at, that's fine. Maybe you reset your goal. If your goal was to go for a walk, you reset that for the following day and then you reassess, right? So make sure you give yourself that pat on the back when you can actually get up and get moving, because sometimes that's the hardest thing to do. And talk to your healthcare team about how they can support you to be active, whether that's your physio or your doctor or your rheumatologist, whatever support that might be. Maybe it's even people in your community who help you to stay as active as possible. So I believe that's my last slide. So I hope that you found that helpful. I didn't see anything coming into the chat, but I am open to any sorts of questions if you have any right now.
Feel free, anyone, to take yourself off mute and ask your questions.
I just raised my hand. It's Cheryl.
Oh, hi, Cheryl.
Hi, I'm wondering, I have a grip master that my husband uses for guitar, and it kind of looks like this, and you put this in your hand and you use this. Would you suggest that that's something good to use if you have the arthritis in the hands and keep using this? I used it for a while, but like it's a very simple little tool where you can kind of grip on it. It keeps your thumb open, like so.
Yeah.
Wasn't too sure whether I should be using it or not.
I think as long as you are almost limiting its use. The challenge becomes sometimes people take something like that and they sit in front of the TV and they end up squeezing it, for half an hour.
Right.
And you want to think of it as more of a strengthening exercise. So it's like, okay, I'm going to do between 8 to 15 repetitions because you do want to try to maintain the grip strength. And it's nice that it's not this tight position. It's nice that it's more open. So it can be good for that, but really think of it as a strengthening exercise. So you do your 8 to 15 repetitions. If your hand is getting tired and after 8, that's enough, right? If you can get up to 15, that's fabulous. But you're also not doing it every day. Maybe it's a couple times a week, 2 to 3 times a week, and you're doing it as a strengthening exercise.
Okay, because I stopped using it. I was using it a few months ago, and then I thought, oh, I better not, because I wasn't too sure whether it was doing more harm than good. But so just use it, just periodically, just as a strengthening exercise. What do you think about laser light treatment on